All right, Mayor.
Thank you, Steve. Good morning, everybody. Today is August the 7th. This is our 15th episode of the Mayor's Breakfast that's been focused primarily around the pandemic, COVID-19, and trying to give good information to our residents. In fact, I was going to just share quickly that it's been our attempt over these last 5 months to bring good information to the residents of San Ramon and to the community as a whole. We've been fortunate that our county supervisor, Candace Andersen, has been here every episode to give us updates on what's going on the county level. And we are fortunate to have the county health office here one morning also to give us an update. We've had the city, both our city manager and of course, Steve Spedowfski, who is here today, our deputy city manager, to give us an update on what's going on with the city. And what I want to compliment the city on is in two areas in particular. The work you've done, especially over this summer, the summer programs for our children here in the community was outstanding, and the protocols you put in place to keep them healthy, but also a really huge shout out to what the city has done, repurposing a lot of our parks and community service personnel to work with our shut-in seniors, and they identified about 450 households and supplying food and services to those shut-ins in this pandemic time. And I know for the people, those folks, and for their families, they appreciate what you guys did to help those families. I can only imagine what it's like to have your elderly parents in a faraway town and not be able to be there for them, but knowing the town was making sure they got fed and followed up and they got their medications. So Steve, thank you. And thank all the folks and the staff who did that. Our police department has given us updates because one of the most important things we do as a city is public safety. Representing us today is, I believe, Captain Carlson, Denton, who is going to give us an update on public safety. I've never gotten all those ranks quite in order. One of the also important things we want to share with our community is how are our local facilities doing when it comes to handling patients and medical care for our residents. And Ann Lucia has been here, I think it's her 5th time to be with us and to share how the San Ramon Regional Hospital is doing, and she'll give us an update. And then we're going to finish with Dr. Joseph, who has been here nearly every week for us and has been a huge source of comfort for a lot of families to know how they can manage their households and their behaviors to stay safe and to give us good information from whether it's masks, social distancing, how to do at-home teaching for pods, folks who may want to do that. And he will give us some information today on the latest updates. And again, a thank you to Dr. Joseph, your busy schedule to be here for us. So I'm going to first look to Steve Spedowfski for an update on what's going on with the city, if you could do that quickly.
Yes, I'll try to do it as quickly as possible, Mayor.
Take your time, Steve. I'm sorry.
Yeah, I'd like to share my screen here because there are two areas that I'd like to just highlight briefly. The first is on Tuesday night, the Planning Commission approved the City Walk Master Plan. It is the proposed 4,500 multifamily residential units in Bishop Ranch that'll be built over the next 20 to 30 years. I don't know if many residents are aware of this, but I believe Doherty Valley is now considered built out. The last parcel was poured a few months ago, and they're finishing up construction on some homes there. And also Faria is underway as well. And those are the last two large developments in San Ramon. So from here on out, it's infill to meet our housing required numbers. So if you go to the Hot Topics page on the website, we have, and I'm going to go over another page, but we call these the deep dive pages, where it's basically everything you wanted to know about a topic. So we put all the information about the City Walk Master Plan here on this website, where you can scroll down and see all of the meeting dates and the associated documents with each meeting. And you could go ahead and go there to answer basically any question that you would have about the City Walk Master Plan. Also on the Hot Topics page, we have a couple of pages. The new district elections page that goes over district elections. This is the first time in the history of San Ramon that we are now electing council members by district. This year we have districts 1 and 3 up for election, and today is the last day for District 1 and for citywide for the mayor for people to pull and submit papers. And I believe District 3 has been extended to Wednesday because Councilmember Alone announced that he is not seeking re-election. So that has been extended. So in District 1, we have 3 people who have pulled papers for candidacy. For District 3, we have 4 people. And for the mayor, we have a total of 6 people who have pulled papers. So if you want to learn what district elections are all about, you can go to, again, the Hot Topic page, click on district elections. You have a very good overview here. You can also click on the district elections implementation. So if you have, again, this is another one of our deep dive pages, any questions whatsoever as to why district elections are here, how they were formed, what the process we went through, just everything you want to know. It's a very lengthy page. We give you the entire history in addition to some frequently asked questions below. And on both pages, if you are wondering what district you live in, we do have links to our city council district application, which is a map that shows each district with the current council member. And you can put in your address. I believe it's probably blocked by the camera here in the upper right. You could type in your address and it will zoom to your street and let you know exactly what district you live in. So with that, Mayor, that was my hopefully brief enough overview of 2 very important items that have come before the city. And also over the next month, we're starting a public information campaign regarding district elections because some residents will not be voting for a council member this election season. So normally you would vote for 2 council members and the mayor every 2 years. Now it will be you're voting for 1 representative from your district once every 4 years. So that will be a change, and we want to make sure that that we get the word out about that.
Steve, thank you. And I want to again compliment you because you're heading really the effort to create a very vibrant place for folks to go to get information about the city, no matter what they're looking for. And I appreciate you doing that. What's interesting is that there's been some criticism about public meetings and Zoom, and people cannot come to public meetings. But what we've found, I'll be curious, Candace, if you've seen the same thing, we're actually having far more attendance and more public participation at our Zoom meetings than we were with the public meetings. I think because it's easier to access them. I know the school board is probably the best example, had up to 7,000 people participating in one meeting at one time. Not all of them obviously could talk at one time, but 7,000 people are watching what was occurring live and could contribute if they wanted to have public comment. And so it's interesting that this pandemic has kept us separated from having personal contact, but it has in some ways allowed a more vibrant public input and more participation. So thank you.
Sure.
Captain Carlson, how are we doing as a city? How safe are we right now?
You know, we're doing quite well, Mayor. And thank you very much for the invitation this morning. I appreciate it. And regarding the beginning of the meeting, I get confused myself with our ranks, and I'm not really sure how I ended up here as a captain. I keep thinking someday someone's going to realize what they did and it'll all come crashing down. But so far, here we are. As far as the crime rates here in San Ramon, we are doing very well as a community. This year is obviously an anomaly. Things are strange and we're going through things that we've never experienced before. But we've heard about the nationwide trends regarding violent crime and how some of those have increased. We're not seeing the same thing here in San Ramon. And what I'm going to refer to now is our statistics as they relate to Part 1 offenses. And what a Part 1 offense is those are the crime statistics that we report to the state of California through the Uniform Crime Reporting Act, and those eventually end up with the FBI for the nationwide statistics. Now, included in these Part 1 crimes are crimes against persons, which include violent crimes, theft-related crimes, stolen vehicles, thefts from cars, and also burglaries. And that's where a home gets broken into or a business gets broken into. So those are all a part of what we consider our Part 1 crimes. And the good news for the city of San Ramon is 2020 has been a great year for crime statistics. Unfortunately, we'd love to have it where no crime is committed, but that's not reality. But so far, when you compare 2020 to 2019, our crime rates are actually down 23.8% when it relates to Part 1 crimes. So that's a huge drop for us. And the majority of those are directly related to theft crimes. We've seen a decrease in burglaries. We've seen a decrease in shoplifting, theft from vehicles, vehicles being their windows smashed and property taken from inside. All those related crimes have seen a significant decrease. The one interesting thing that I'm not really sure the reasoning behind it is actually vehicle thefts have gone up a little bit. So that's one area where we've seen an increase, but overall we've seen a dramatic decrease. And it has a lot to do that people are at home. People aren't out and about. People are around their property a lot more. Shopping centers aren't as busy as normal. And usually that is a high crime location when it comes to auto burglaries and people breaking into cars. So we've seen a really big decrease this year, and it's been a welcome change. Not that San Ramon has ever been crime riddled. We've been a very safe community for a long time now, but we've seen even more of that safety specifically over the last 7 months of 2020.
Great. Thank you very much, Ann. Thank you for hanging around. We may have some questions, Steve. This is a segue, by the way, in that if you have any questions for any of our guests or for the city in general, you can address them at info@sanramon.ca.gov. And near the end of the program, Steve will be collecting these questions and those he's already received. And so there may be some more questions circling back to you. Thank you very much, Captain.
Of course.
I'd like to turn to our county supervisor, and I do this every 2 weeks, and I want to say it again, how much I appreciate you being here every week, Candace. The information that you supply to us, I know some residents are really mad that it's not more open. There are other residents who are mad at you because it's not more closed down. You are sometimes the messenger of information. So I want to again thank you for all the hard work you've done. We commented before the program started that who was to know that this year you would become almost an expert around health issues and pandemics, but thank you for doing that. So how are we doing as a county and what's up?
Well, thanks, Bill. And it really is my pleasure to be with you every other week. My goal is to have as much transparency, as much information, as much scientific data as we can collect so that people can make choices and hopefully make safe choices with regard to what they are doing with their lifestyle. So when I was here 2 weeks ago in the county, we had just over 6,400 cases. And now we're up to 8,532 cases. So we've seen in the last 2 weeks an increase of about 2,100 cases. Now, yesterday we saw in the county 206 new cases. However, as many of you have heard, we are having trouble with the state's database, the CalReady, that gathers the data from all of the different labs and then sends it out to the counties. They realize they've had some flaws in the system, and so it has impacted. What we are finding is we're getting the positive cases back quickly, not the negative cases. And what that does is that skews our positivity rate, which is one of the indicators used by the state to keep us on the watch list, and also an indicator for us to take greater precautions. We really want that indicator being under 5% of the cases that tests we make being under that amount. You know, we were up to 11% last week, but again, we believe that was skewed. So we no longer on the county's dashboard put the percent positive. We do put the positive cases, and that's really a very helpful snapshot of what is happening. Now, in the city of San Ramon, and when I spoke to you 4 weeks ago, you were at 109 cases. 2 weeks ago, you were at 146, and today you're at 186 cases. So in the last 2 weeks, you've had about 40 new cases, and still it's better. Your increase is better than what you jumped through June to July, where you had over a 200% increase. Bottom line, it's still being spread within the community. Some data that is not corrupt, and I want to say the state data is corrupt, but that is very, very clean data is our hospitalization rate, as well as unfortunately our death rate. And so our hospitalizations are still quite high, but fortunately they're stabilizing and actually declining a little. Yesterday we had 99 patients hospitalized. That's better than a week ago when we were up to 110. And right now our 14-day average for hospitalizations is at 102. Now keep in perspective, that back in early June, 2 months ago, we had 13 people in the hospital. Early July, we were up to 54, and then quickly that number doubled. This also is at one of the bases for us being on the state's monitoring or watch list. Now, since we last met, we've had 32 more COVID deaths in our county. And when I was with you 2 weeks ago, the numbers were showing that 70% of our deaths were associated with our long-term care facilities. That percentage has dropped, 64% now of the deaths are now connected with long-term care facilities, and the other 36% are just general community spread. Now, in the last 7 days, we've had 15 deaths that have been just in the general population. The last 7 days, 10 of our deaths have been in long-term care facilities. And so it's a disquieting trend that we're seeing that more deaths are happening outside in the community rather than in this more vulnerable population. And it's not just old people, 28 deaths have been from those in the 50 to 70-year-old range. And so there's sort of this idea out there that it's just old people, and if we can just protect them, the rest of us are going to be fine. And the reality is that's not the case. Now, of course, we still are on the state's monitoring list, and it does impact our school openings. And no one is going off the state's monitoring list until they figure out how to fix that data issue with CalReady. But we do have more information about what reopening is going to look like. Currently, Contra Costa Health Services will not be approving any waiver requests for in-person education for elementary school students. They just believe it is too risky, and until our daily case rates, our percent positive test rates, and hospitalizations in this county are stable or declining for at least 2 weeks, we're not going to be reviewing any of these waiver requests. On Monday, the state finally issued some guidance outlining the process and criterion for elementary schools to apply for waivers, allowing this in-person instruction. And once things have stabilized, that's when schools can submit an application, but they do need to demonstrate some important things. One, they have to have a plan to perform surveillance testing of staff, and they want at least 25% of staff tested every 2 weeks, 100% of staff each month. And they also need to have secured an agreement with a lab that has the ability to provide test results within 72 hours. As we've discussed previously, because of the high demand for testing, labs are taking 12, 14, I heard even in one outlier, 17 days to turn around the test. And I will add that the county on Tuesday at my 12-hour board meeting, which goes to great public participation, which we love, but we did literally have a 12-hour meeting. We did approve 2 new contracts with labs. Next Tuesday, we will be approving 2 additional contracts with labs that are providing us with some sort of a guarantee that they can turn the test results around quicker. I will add with testing as well, first responders, healthcare workers, their test results go to the county lab, which we can turn around within 48 to 72 hours. So high risk populations that need to know immediately are getting that turned around. But anyway, the school has to have some contract with a lab that can turn test results around within 72 hours. And the reason for that, of course, is we need to be able to have adequate contact tracing should an outbreak occur. And they also need to have, the school has to have selected some staff members who are going to be trained in contact tracing methodology, and they're going to agree to help Contra Costa Health Services in collecting that tracing information. And in fact, next week, we are, the county, doing a tabletop exercise to train school staff on how to collaborate with the health department in contact tracing. They will be filming that, and so school personnel that have not been able to receive that training will be able to do it that way. The school will also need to meet some additional criteria required by the California Department of Health with regard to masking, spacing, things like that. We will be working continually with Lynn Mackey, the Contra Costa Office of Education, and our other education partners, really about when local schools can start submitting those waiver applications. So no one is able to now. So right now we also have had new guidance from the state with regard to sports. And this is an interesting one because we, from the time we were opening up childcare and we were opening up those 12-person pods, which I know the city of San Ramon did a fabulous job in setting up these summer camps, we were allowing just about any type of activity, including closer contact sports activities. And camps that don't have those sports activities may continue, stable groups of 12 or fewer children. And these stable groups can involve educational groups of children. And so although schools are not opening, there is the ability to provide SAT camps, ACT camp, preparation camps, other types of study camps as well. Children should not be changing from one group to another. They should be stable for at least 3 weeks at a time. And the providers or educators of those groups have to remain with only one group of children. They can't split their day with different groups of children. And if it's a camp that involves any aspect of sports, we've got to look at the new youth sports guidelines that have come down from the state. And essentially what they have said is you can only have any youth sports if the youth can remain 6 feet apart from one another. And so for contact sports, and when I say contact, I don't just mean football, but baseball, soccer, where you have to come closer than 6 feet, you can only be doing conditioning and training. And so this is a big change. This is something that it's going to make it a little bit easier for some of our cities to enforce what's happening on their play fields, because oftentimes people say, no, we're just a camp of 12, when in fact a full game is going on. But the state has come out with this guideline, and it's important to note, as I've said before, there are state orders and county orders, and the way it's really come down is whichever order is a little more restrictive, that's the one that is going to bind everyone. Does not have any impact on swimming because we already are doing that in a socially distanced way, but it does ban all tournaments, events, competitions, regardless of whether it's from the same school or different schools for now. We did back, and I mentioned that we were looking at it on July 28th, administrative fine schedule. And this is something that is countywide. Each city can choose to enforce administrative fines for violations of the health order if they want to. The goal is still education. None of us envision police patrolling up and down Crow Canyon and Bollinger Canyon roads looking for mask violators. That's not the point. The point is when someone is refusing to comply with laws, and more often it might be a business that chooses to open in defiance of the health order, we do have a structure for an administrative fine. It can be appealed to a hearing officer. And the nice thing about this is previous violations of the health order were misdemeanors. It was a criminal prosecution. We wanted to avoid that. So it's more like a parking ticket, an expensive parking ticket, albeit, and for non-commercial fines. First violation could be $100, second violation could be $200, next could be $500 for each additional violation. And for commercial fines, it could be $250 for the first violation, $500 for the second violation, $1,000 for each additional violation. The district attorney for the county is receiving complaints from individuals as well as your non-emergency police services. Oftentimes, if it's a business, and particularly if it's a restaurant or a bar, ABC, Alcohol Beverage Control for the state, may get involved, and they will notify the appropriate jurisdiction that they are doing this investigation, and they may go in and approach the property owner, whoever's running the restaurant. And so again, first education, but it's important that we have one, an even playing field for businesses, two, we have a safe community, and we really want people to comply with these orders. A more recent order that also just came out is further clarification about isolation if in fact you are diagnosed and you have a positive COVID test. And so you're required to isolate yourselves in your home or another residence. And there's a whole list of ways in which you should be doing that. You need to tell your close contacts. And the isolation period for individuals without symptoms who have a positive test is 10 days from the date of the positive test. Individuals with symptoms, must isolate until at least 24 hours after they've recovered, which is defined as a reduction of fever without using fever-reducing medications, improvement of your cough, shortness of breath, and other symptoms that may have been present, and it has to be at least 10 days have passed since their symptoms first started. If someone has been hospitalized in an ICU, they still need to obviously isolate at least 24 hours since recovery and at least 20 days since their symptoms started. And again, this is a way to help protect the entire community as well as those who are afflicted with it. With all that is going on, our recommendation is to continue to use due diligence. You really need to be wearing your mask, washing your hands, staying home when you're not feeling well. And if you're in a vulnerable population, really consider the simplicity of having groceries delivered, having friends pick up medications that you might need. It's just not worth it. It's definitely still spreading within our community, and none of us are immune to it. And you can unknowingly spread it to someone that you love, but we also are just getting much more serious about what we're seeing through our contact tracing, which is a lot of it appears to be coming from mass gatherings, meaning, and when I say mass, more backyard barbecues, weddings, graduation parties that took place in the month of June. We just need you to be vigilant.
Great. Candace, thank you very much.
You're welcome.
And thank you for sticking around for any questions that might come up near the end. Now for a more micro view on what's happening on the ground in San Ramon at our local hospital as Ann Lucia. And thank you so much for being here. What observations can you give us about what's happening locally at your hospital?
Yes, thank you, Mayor Clarkson. As always, I want to say thank you to the city and thank you to the county. This is a huge collaboration between so many different entities, and I'm so grateful for the support and grateful to be located where we are because we really have an amazing team and a lot of really amazing people working together. So thank you all for your support. I'm happy to say the hospital is doing well. So in previous reports, I've shared how we've been doing. I'll continue to share what we currently have in-house. So currently we have no individuals who have tested positive currently in the hospital. We do have a couple of patients who are waiting for test results. As Supervisor Andersen mentioned, test results are not immediate, unfortunately. And so we are waiting for a couple of patients to get cleared. At any given point, we always have a couple, but we've fortunately not been overwhelmed by the number of patients in our area because I think, as she mentioned, the number of patients who've tested positive in San Ramon is low relative to some other parts of the county. And I'm very grateful for the efforts that everybody in the San Ramon area is putting into social distancing, wearing a mask, following the guidance of our county health officer. I think it makes a big difference. I often get questions about how you can support our care workers and our hospital. The biggest thing you can do is to do your part to prevent the spread. We keep the numbers low in our hospital. In general, I believe our hospital has had the lowest number of positive COVID positive patients in the county, and it's been manageable. That being said, we have followed that trend and are very closely paying attention to the numbers on a daily basis to make sure that we know what may be coming our way and whether things are going on upward trend or a downward trend. Continue to have appropriate PPE supplies, and we're able to safely care for our patients. We have very rigorous infection control practices in place, and we're constantly monitoring the frequently changing guidance from CDC, from the California Department of Public Health, as well as from the county. And so as safety measures change or adjustments are issued, we obviously have to adjust to those as well. I think the most important thing that I want to deliver as far as a message today is, healthcare is very important, not just COVID care, but care for anybody who's having a health condition. It is very alarming to see the number of vaccination rates going down, cancer detection rates going down, preventive care being deferred. And so, please don't put off your other medically necessary care. The emergency room is safe. It's here to provide care for anybody who needs care, whether it's COVID or something else. The EMS providers I know are very well equipped to handle very safe transport and care for people in the community. So please don't put off getting your medical care. It's very important that we listen to what our bodies are telling us, and if there's a medical issue, listen to it. I also would share that the physician offices are safe for care. You can call, there's a lot of doctors who are facilitating telehealth now, but there's also a lot of in-person visits happening. If you need to get a checkup or if you need to go check in with your physician, don't put it off for months. Please go talk to them, because it's very important to make sure the ball is continuing to roll on any medical care that you need. And that's something that we're seeing is a trend across the county. People are afraid, and so they're putting it off. I would also mention that for our hospital, we have an ambulatory surgery center. So there are patients who are afraid of having surgery in the hospital because they don't want to step foot inside the hospital, even though it is a very safe environment. And so we do have an off-site location within the campus, but a totally separate building where patients can go for care without even having to come to the hospital. We do have capacity in the hospital, and we're able to care for patients who come our way. We're going to continue following our very safe practices for infection control. Dr. Joseph is probably emailing back and forth with us on an hourly basis. And so we are very much up to speed on the very latest information, and he guides us very dutifully and with so much expertise on how to make sure we don't miss anything that we need to be doing to protect our patients and our staff and clinicians. It's safe to have your baby in the hospital, all these things that we just want to reiterate, because we don't want to see other bad outcomes in healthcare because of a fear of what's happening with COVID. And lastly, another thing I would mention, since you mentioned the electronic or virtual meetings, we've been embracing virtual as well. So we've been doing virtual childbirth classes, for example, and other types of sessions that are now virtual for patients. And we've seen actually an increase in attendance as well, because it is making it accessible to more people. And so that is some silver lining in this whole process, is that more people are getting access to care because they're able to attend the classes or see their physician without having to drive a long distance. So that is something that we are continuing for the foreseeable future, because our passion, our mission is to reach people where they are and to get them the healthcare they need in the setting that works for them. Lastly, I just want to say thank you. We've been overwhelmed with the outpouring of support. And I know I speak not just for San Ramon Regional Medical Center, but for all the hospitals and all of the healthcare facilities in the area, when I say that we're so grateful to the community for so much enthusiasm for our employees, for our clinicians, so much outpouring of love and appreciation for what they do. And we're really very grateful. And again, the most important thing or helpful thing you can do is to continue to social distance, wear your mask, and do your part to prevent the spread. So thank you.
And thank you. And it should be mentioned that you are the one who recommended to us Dr. Joseph to join us on the broadcast from the very beginning. So thank you for doing that. But I also appreciate you spending some time and talking about the importance of preventative care, of encouraging people to come in if both for their regular medical checkups. Don't put that off, because I think, especially in our valley, we'll have more health issues long-term from people not getting health. If they've got shortness of breath, if they have issues with their heart, they think, not be afraid. San Ramon Regional is a safe place to go. Your emergency room is a safe place to go. You have protocols in place. You're far more at risk by putting stuff off and delaying. So thank you for that message and encouragement.
Thank you.
Dr. Joseph, thank you again for being here almost every single week with your information that you share with us. I am still looking forward to hearing what you might want to talk to us today about. So Dr. Joseph, you're up.
Well, thank you very much, Mr. Mayor. And again, thank you for the invitation. These are always enjoyable, and I always learn from all of the panelists. I will just, before I get started, let me embellish just a little bit about what Ann Lucena said. I totally agree with the safety of the hospital and the doctor's offices. Let me add to that dental care. The dentists have extremely strict guidelines in order to provide a safe environment. Remember that what a dentist does is creating an environment that puts this virus into the air. And therefore, they are the ones at greatest risk, not the patients. And because of that, the American Dental Association and local dental societies have given them guidelines that are almost, if not more, strict than what we have in the intensive care unit of a hospital. So I would encourage those who need dental work not to put it off because of the current pandemic. And I'm going to share my screen now. Well, let's see what we can get. And someone will tell me if this is not showing up, but it looks like this is it. And again, the title is not getting over COVID, but learning to live with it. It is going to be with us. And so I'm going to have some remarks today that we have regarding PCR testing, those that have persistent symptoms, some aspects of medical modeling and contagiousness that we have learned, and I'll discuss the case fatality rate and the impact that may have with us. So this is a cartoon on the left. It's actually a real person with a cartoon imposed on it. This is the way the standard original nasopharyngeal test was collected. So the swab, this has been, I think Supervisor Andersen called this a brain biopsy, and sometimes it feels like that. There are alternatives to this now, but this is the classic test of how it was first described. There are other tests where the swab does not go back as far, and there are even throat swab tests that can be done. But the typical test is the tip of the swab is twirled and picks up both mucus and cells that may have virus in the back of the nasopharynx. Now, what I want to focus on now is what's on the right. The term PCR is common knowledge to almost everybody now. The CR means chain reaction. This is a chain reaction test, and the cartoon on the right shows a picture of the coronavirus, and the coronavirus typically has only RNA or nucleic acid in there. That sort of yellow cream colored chain that looks like a string of pearls or a string of beads is the only thing that's in there. This virus can't live by itself. It has to get inside a cell. But the PCR test does not look for the virus. It only looks for small segments of the nucleic acid. And I've put 3 circles there because there's 3 options that we use in the laboratory. And typically a test will identify 2 of the 3. So it's not looking for a whole virus. It's just looking for a fragment. If an individual has symptoms and these small fragments of the virus are detected by a laboratory, that's enough to make the diagnosis of an infection. Now, the reason I brought this up is because these fragments of the virus can hang around in a person's throat for a long, long time. But remember, we're not looking for the virus, we're just looking for fragments of the nucleic acid. And this is what happens if we look first at the cartoon on the left. The red bars are how long that pieces of virus can be recovered from the throat. So at 3 weeks, still 1 out of 3 patients has fragments of virus in their throat, but they're not infectious. The arrow, the yellow arrow at the bottom of that graph is about 10 days after the onset of symptoms. And for the typical person who is out of the hospital, a community infection, that's when they become non-infectious. And that's why the guidelines over to the right for the average person that was mentioned by Supervisor Andersen, they can go back to work 10 days after the onset of symptoms, as long as the symptoms have improved, and 24 hours without a fever. And that is the overwhelming majority of the patients. So doing testing on those individuals will still have a positive test, but it is not recovering contagious virus. It's not recovering infectious virus. It's recovering fragments of nucleic acid that are still present in dead and dying cells. So the PCR test is a great way to make a diagnosis, not a good way to determine the lack of infectivity after a diagnosis. So it's no longer used. And I say that because in the beginning, it was required to have 2 negative tests before we could say a person could go back to work. and that's no longer used. And you can see why by the red bars, how many people will be positive, even some out to 5 weeks. And I've had patients who have been positive for 2 and 3 months, but definitely not infectious. The next topic is symptoms. On the left side in the blue bars are the number or the percentage of patients who have symptoms when they have an acute infection. And you can see that being tired or fatigue, breathlessness or cough are the highest on the list. But looking at the right, this is a large group of patients, 1,300 patients that were sampled 2 months after complete resolution of the virus, 2 months after they were not infectious, 2 months after the infection is gone. And you can see that almost 60% are still having symptoms of being tired, breathlessness, joint pain. So we're now learning that this virus not only has an acute problem, but a long-lasting problem, and that would be called morbidity. So an individual's ability to recover can be related to age, but this can hang around for a long time and cause individuals not to be able to return to activities of daily living, not be able to carry on their job, particularly if their job requires a lot of physical activity. So this is part of new information that is helping us manage patients, not only for the acute diagnosis, but also to reassure them after it's over that they will get better. But this takes a while. This is not something that goes away overnight. Now, modeling. There's fashion modeling that I know nothing about, but there's medical modeling or statistical modeling that we hear all the time on the news. And let's look at this definition, because this has been the subject of far too much accusations, and particularly on the national news during an election year. Statistical modeling means that we're using our current information to measure the probability of something happening. And I'll give you an example on this. I hear this on the news all the time, that a particular doctor or a particular newscaster or a particular medical institution lied to us or gave us wrong information. That is an allegation that is not correct. What they did was statistical modeling, using the current information to measure the likelihood of something happening. And inherent in that comment is that there's no change. And this virus has been the fastest changing epidemic that any of us have ever seen. So although someone is saying this is what we have to prepare for, they're also saying that this is what we have to prepare for unless we can make changes to improve the situation. So I'm a firm believer that no one who cares about patients and who cares about science is lying. All they are is saying what was modeled at the time, and that represents a need to change. So the interpretation is different. Modeling tells us that we have to do something rather than telling us what will happen. So let's take a look at some statistical modeling that exists. Contagiousness. Now, the term for contagiousness is R0. It's a capital R with a subscript 0, but it's pronounced R0. And the definition is how many new persons will get infected from one case. So if we have a person at a fraternity party who is infected, the number of people that will get infected at that fraternity party is a lot. If we have one person who is wearing a mask and is in public, the number of persons that will get infected from that one case is substantially lower. And if you put all that together, that is the number of new cases from the number of cases that we know of in March, R0 was 2.5, meaning one person in March would cause an infection or spread an infection to 2 or 3 other persons. That's what R0 is. And from an R0 of 2.5, we needed 60% of the people in the country to be immune to create this concept of herd immunity. Herd immunity means that enough people are infected that you don't need to worry about it. Where we are today with chickenpox, where we are today with measles, mumps, and rubella, that we take precautions, but we do have herd immunity. Herd immunity is based on the number of new cases. And so a calculation of R naught changed dramatically between March and July. And currently, with this big uptick, with the steep part of the curve, one infected person will infect 5 to 6 other persons. It's a dramatic change. And that's why the curve changed. Now, what the relation to this is not because the virus changed. This virus did not become more infectious, more dangerous, more contagious. What happened is that more people got it and fewer precautions were taken. So we are currently at our R naught of 5.7. And that means that we need to have about 80% of the people in this country to develop herd immunity. Now, just as an aside, we're currently sitting probably around 2 to 4%. So we are nowhere near herd immunity. And we're not going to get there until we have an effective vaccine. So that's just an aside. Herd immunity doesn't occur by people getting infected. Herd immunity occurs only by vaccine. And that's where we are with all of the childhood diseases. So this R naught means that today, one infected person can infect 5 to 6 others. This is modeling, unless we make a change. Now, if we make a change, we can get that R naught back down. So if I go on a national news today and I say one person can infect 5 to 6 other people, and 3 months from now, that's not true, it's not because I was lying. It's because from modeling, that was true in that case, and we need, or at that time, and we need to make a change. So this is what we have done in the past. We want to reduce contagiousness. And in scientific terms or epidemiologic terms, we want to lower the R naught. Now, what happened with Ebola in West Africa is a good example. I was involved with the CDC at the time, and it was very clear we could not keep Ebola out of the United States. That was tried for a while. It was ineffective. So we sent a team to West Africa. And the way we reduced the contagiousness is when there was a diagnosis of Ebola in a person, we traced it back to where they lived and we isolated the house, and Ebola went away. Now we can apply those same principles to some degree to our current pandemic with COVID-19. That is, if we identify a case, and a case is a positive test, when you hear number of cases, that is not because people have symptoms. That is not a case in the United States. A case requires a positive test. Then the contact tracing that was described by Supervisor Andersen to find out where they got it or who they may have exposed, and isolate not only the infected person, but those to whom they may have had a contact. So if I'm infected today and we find out that I had close contact with 5 other people, we put all of those 5 persons in isolation or quarantine. And that's how you lower the contagiousness. That's how you lower the R naught. And the other thing is emphasizing the importance of changes in behavior. We are all experiencing COVID fatigue. All of us want to have this gone. And for that reason, we are letting our guard down. And it's people like our public health officer, our community service persons that are saying, no, don't. We can't do it. This is a brush fire. And if you stop controlling the brush fire, it will turn into a wildfire. The only changes that we have right now that need to be emphasized are the big 3: masks, distancing, and hygiene. That's what we need to emphasize. If we could get everybody to follow that, the number of new cases would fall like it went over a cliff. And yet we all understand why we don't do it. We're tired, but the importance of emphasizing masks, distancing, and personal hygiene. Keep your hands out of your face. If you touch something, use a hand sanitizer or wash your hands. These will work. I understand why it's hard, but these will work. So the next topic is the case fatality rate, something that is quoted often, sometimes misquoted, and frequently misunderstood. The bar graph on the left shows the case fatality rate by age group. So if we look at the age group of 45 to 54, it's 0.5%, meaning if 200 people in that age group get infected, one person will die. That's how this is calculated. And what we all know is the case fatality rate is related to the age. What's not on here, by the way, are new numbers of infants. That is less than 1 year. They have a substantial complication and fatality rate. This lumps together, for purposes of this slide, everybody under the age of 20. And of course, the older one gets, the greater the fatality rate. So off to the right is how it's calculated. That is the number of persons who die over the number of cases. So if we look at the 45 to 54, and we say there's one death in 200 patients or 200 cases in that age group, the case fatality rate is 0.5%. That's 1 in 200. This is often quoted. But this is the issue that we all must understand. The number of cases is totally dependent on testing. And this can be the good news. It is estimated that there are 10 to 20 times as many persons with COVID as have been tested. And this is because of the difficulties we've had with testing, or the reluctance to be testing. Or even today, I've had patients who call me and they have shortness of breath and they have a cough and they think they have a fever. And they say, why don't I just stay home? I don't want to go get tested. Why do I have to get in my car and go out? I feel like crap. And they make a good argument. But this does skew the facts to the point that we may be better off than the graph on the left. So there likely are a lot of people who have had this disease or even have it who are not identified as a case because they're not testing. And I want to give that out as good news. That doesn't mean that we still have a number of people dying. You cannot change the absolute fact that we have had almost 800,000 deaths in the world. We've had, well, I think we're over 100 in Contra Costa County of people who have died. So we don't want to discourage that, but I do want you to understand that this is how the case fatality rate is determined. And now some interesting facts. I'm not swayed by the comment that forcing me to wear a mask is infringing on my rights. I don't agree with that. It's like saying for me to have to wear a shirt when I go into a store is infringing on my rights, or having to wear pants in public is infringing on my rights. Wearing a mask is to help others. And these are pictures from 102 years ago. Now, I know that the one in the upper left and the streetcar and on the upper right is a Georgia Tech football game, family at the bottom. I know those are all in the United States. I'm not sure about the one with the police officers, where that is from. But this was a pandemic similar to what we have right now. And as you can see, masks were required. Masks work. Masks stop the spread of the virus. They're not so good at protecting you, but they protect those who you are around. And I've said this over and over again. Masks help protect me if you wear it. If I'm wearing a mask, I am protecting you. Masks are important in this pandemic because at least of the third of the people who have this infection don't know it, or they have minor symptoms and they don't think they're infected. That's why we want everyone to wear a mask in public. And this is a common cartoon or a common photograph that is used. show them you care, wear a mask. When you walk down the street, when you go visit people, show them that you care because you don't know if you are excreting the virus. Now we have about a minute or two left. So let me add something on here that I think is educational. I want to talk about anecdote and how anecdotes can create problems unless you understand what an anecdote is. This is a report that came through the CDC of the spread of a virus in a restaurant in indoor dining. And with research tools, we can tell if two people have the same virus or if two people got the virus at different places. So that is a research technique that is used in circumstances of a closed epidemic. Sometimes we use it in the hospital, sometimes we use it in other circumstances. But these were 10 persons all infected with the same virus on a third floor restaurant. And the third floor restaurant had no windows, but it did have air conditioning. And the air conditioning was limited to that floor or that restaurant. And it was shown that this caused 10 people to get infected from one index case. No one's wearing a mask, of course, because they're eating. The tables at that time were 3 feet apart. This shows that it can happen. Now, I didn't put this up to discourage indoor dining or when we do get back to indoor dining. I put this up to discuss anecdote. An anecdote is something that is recognized as having happened in medicine. A medical anecdote happens once. It is an impetus to study. This does not mean that this is the norm. So when you hear something on television or when you read something in the news, ask yourself, is this an anecdote or is this something that is confirmed to be a reality or a probability? This is the only, of all of the indoor dining that is occurring around the world, this is the only one that I know of where it has been spread by air conditioning. Typically, we say that air conditioning is beneficial. So I put this up as an anecdote, as something that is maybe a one-off. It may never occur again, but it is an impetus for study. So pay attention when you hear things. Is this something that is likely or reliable or probable, or is this something that we don't need to worry about until we get more information? And so with that, I will stop my remarks for today. I thank you again, Mr. Mayor. It's always a pleasure, and we'll just see what happens next.
Thank you, Dr. Joseph. And by the way, Anne had to depart and take off to an appointment. So she said at 10 o'clock she had to go. And so we will save those questions for her and perhaps follow up later on. Speaking of that, Steve, do we have any questions for our guests?
Yes, we do. And again, Mayor, just as a reminder, I'm trying to combine the many questions. Personally, it kills me that I can't read them word for word because there's some really great questions, but in the interest of time, I do need to combine them. And the first question revolves around enforcement and the mask enforcement order. Somebody writes in that, that they've read that there have been gyms or a particular gym in Walnut Creek that the police department's aware of that is open and operating. And it seems like the police are not intending to enforce the activities at those clubs. What's the plan for San Ramon in terms of hearing about violations? And Captain Carlson, if you could just comment on how San Ramon's enforcing it.
Sure. Thank you, Stephen. No, that's a good question. And it's one that we've received a lot, especially recently after the resolution was passed by the county supervisors and Supervisor Andersen associated with finding people who are in violations. So the approach that we have always taken within San Ramon has been educational and not enforcement. We've received numerous reports of public health order violations, and they come in fairly consistently, not overwhelmingly so. But anytime that one does come in, we respond and we take an educational approach instead of enforcement. We're working with the City of San Ramon's Code Enforcement Division for businesses related to violations. And as of this point, we have not issued a citation for a violation of a public health order within the City of San Ramon. From my evidence of walking around San Ramon, being involved in the San Ramon community, driving around and being a part of this, both living and working in the area, I see the vast overwhelming majority of people abiding by the public health order. Now, we do have outliers who will violate, and we do respond, and our officers are going out. And just last weekend at a park in San Ramon, there was an organized baseball game with parents in attendance and kids on the field and people that were blatantly violating what is the public health order. And our officers did respond. Again, we took an educational approach. The coaches agreed to stop the game and to properly go through the city reservation schedule for permitting of fields to ensure that this doesn't take place in the future. So that's always been our approach, has been educational instead of enforcement. And we don't have any plans to change that approach in the near future.
Great. Another question, I've received one from somebody who appears to work in the healthcare industry, and that they often hear people infected despite precautions. You know, they're only going to grocery stores or pharmacy and they're wearing a mask. And the question is, what is the latest thinking regarding the transmission from aerosol virus particles? So Dr. Joseph, I don't know if this leads into the anecdote discussion that you mentioned, that there might be unique situations where people get it despite wearing a mask, but if you can expand on that a little bit.
Right. So the masks that we are encouraging are exhalation filters. They work for those people who are shedding virus to help protect others around them. They are not 100%. And that's one of the things that maybe I've never emphasized, that although they are beneficial, it is not 100% effective. It does not capture 100% of the virus that is being spewed from a person who is infected. If an individual is known to be infected, there is no reason for them to leave the house other than an emergency. Simply stated, you don't go to the store, you don't put on a mask, you don't go to the supermarket in knowingly being infected. That mask is not 100% protective of the other people in the store. You must stay home.
Great. I had a follow-up question for Dr. Joseph. If somebody might be infected but asymptomatic, are they shedding so few viruses that a mask should protect those that are around them?
No. The amount of virus that is shed can be the same for asymptomatic as moderately symptomatic. Those who are severely ill in the hospital are in a different category.
Thank you.
All right, one for Supervisor Andersen. Can you share an update on how COVID-19 will impact the election process in November in Contra Costa County? Are there still plans to hold in-person voting options?
Yes, and so right now we're still waiting additional guidance from the state, but every single person is going to get a mail-in ballot. Many of you who are not already registered as vote by mail may have received a card in the mail that said, hey, do you mind verifying your signature? Because that's one of the main reasons that absentee ballots are thrown out, because the signature when you registered to vote when you were 18 years old might not match your signature when you're 59 years old, many years later. So if you get that card in the mail, sign it, return it, all postage is paid. We will though, besides that, and we're trying to decide how many in-person voting sites we will have and how many days they will be open ahead of time. But that is also contemplated. We will be having ballot drop-offs. We'll be working with the cities. You'll be hearing from our elections division about where to put those ballot drop-off spots where it can be done safely, of opening and dropping them off within City Hall or other places. But absolutely, this is a year to vote by mail. There is zero reason. We have complete confidence in our ability to process these ballots without any foreign interference or any corruption. There's no reason for you to be standing in a polling place, even if you're 6 feet apart. Shouldn't be necessary.
Right. Another question, and Dr. Joseph, I believe you've addressed this one in particular, and it may have been in episode 3, 4, or now that we're up to 15. It is a popular question, and it's worth readdressing briefly. What are the risks of contracting COVID from lap swimming in a community pool?
Very, very small. Lap swimming, lanes and lap swimming are now designed to be far enough apart that it's extremely unlikely that a person will cough or spit on another person. You almost have to imagine a situation where that could occur, but it requires face-to-face. But typically, individuals who are capable of that type of exercise are not coughing, not sneezing, and not symptomatic. So if the amount of virus, as Mr. Mayer mentioned earlier, although the same amount of virus is exhaled by talking for those who have symptoms or those who don't, coughing and sneezing increases that many-fold. Lap swimming, in the absence of unusual circumstances, is safe.
All right, I think we have time for a couple more. Someone writes in, why is non-essential indoor shopping still open in Contra Costa County when indoor malls are closed? What's the difference?
And I can't tell you what the difference is. That really was a result of the state's order coming down. I think that the main difference perhaps would be that within a mall, there's more interaction of people, there's more sitting around, there's more wandering through, going into different stores, where I think now, if you're going into a store with a purpose, you go in with your mask, you're not just sort of lingering around other people. And fortunately for San Ramon, your beautiful city center mall is an outdoor mall, so it has not had to shut down.
All right, and then also this one for Dr. Joseph, can you provide an update on a vaccine development? And as a medical professional, how confident are you in the development process currently underway in the US?
Good question.
My confidence is high. I've been involved with vaccine development for many decades. And what we are doing now is not only having the usual process by one or two companies, but we're having novel processes by at least 50 companies trying to develop a vaccine quickly. And the reason my confidence is high is when you get that many brilliant minds with one goal toward the end, and this is far more, by the way, than we've ever tried for AIDS, or RSV, other things that are very difficult to make a vaccine for. So my confidence is high because of the bright minds, the number of people, the resources behind it. The timeline is going to change for our benefit. And I've not mentioned this before, so it goes something like this. Typically, when you develop a vaccine, you give a vaccine to 30,000 people and you give a placebo to 30,000 other people, and you follow them over time and see if there is a difference in the infectious process. And so it takes time. And that's why we are always saying that, vaccine development takes a year or two. It just takes time for natural history to show a difference in those two groups. We are approaching a situation where it may be permissible for volunteers to expose themselves to the virus. Now, you can do this with animals, and animals, it's being done with camels, llamas, monkeys, all of whom can be infected by this virus. But if we create a legal situation and have volunteers who are willing to expose themselves to the virus, the timeline will be dramatically shortened, and we could have something much sooner than expected.
Great.
Any predictions?
No.
Okay.
If you want predictions, you go to the nightly news or the YouTube, but no.
Yeah.
Well, I'll rephrase it. Do you think a year from now there'll be a vaccination?
I really don't know. It's
Don't know.
I think I've never, as I said, in my career of several decades in infectious diseases and immunology, I have never seen this much effort toward one goal, and that is to protect a healthy person from getting infected.
There have been some some tests that have gone through at least one or two layers of protocol and appear to be promising. So does that mean there may have been a vaccination that's already been created that will work, but just needs time before it becomes viable? Or do you think that no one's discovered the keys yet?
We may have discovered the keys. Trials have already started. Phase 3 trials is where you're giving it to healthy subjects, and we're in the tens of thousands of persons who have received investigational vaccines. And if that works, the answer to your question is, yeah, we found the key to the lock.
Great, thank you. Steve, are we out of questions or we have time for one more?
Seems like we're out of time.
Okay, thanks. He's sort of the time master here, so we let Steve regulate that. I want to thank all of our guests, Anne, who was here before, Candace Andersen, Supervisor, thank you again for your updates. Denton, keep up the good work. All residents are so appreciative of our police here in San Ramon. We love you guys. We appreciate what you do every day for us, and so thank you. Make sure every one of our beat officers and those who are sworn know how much we appreciate what you do for us every day.
Will do, Mayor. Thank you very much.
No, thank you. And Dr. Joseph, thank you. We really appreciate the time you spend, not just with us, but we also appreciate the time you spend getting ready to meet with us and putting together a thoughtful presentation. Steve has been organizing these in some YouTube formats, so people really love watching these things afterwards. It's very appreciative and very reassuring for us, because when people understand, as I mentioned earlier, when people understand what's going on, they don't fill the vacuum up with bad information. They can make good decisions based on good stuff. So thank you, sir. You've been invaluable to our community.
Thank you very much.
Steve, as always, thank you for organizing this, keeping us on tasks. And I wish everybody a safe and mask-filled weekend.
Yes.
Thank you very much. Have a great day.